COVID-19 pandemic, it's something that touched everyone all over the world, and that does not exclude cancer nurses. It does not exclude my society, the European Oncology Nursing Society. From a clinical perspective, we can say that the COVID-19 pandemic had a tremendous impact, for example, on the well-being of cancer nurses, many of which had to work on the front line for the management of the pandemic, and in many cases at the expense of their own well-being. That translates into working longer shifts than usual, having less time to recover from the shifts, but also in conditions that pose threats also to their physical safety. They had to deal with situations of, for example, lacking of personal protective equipment, and most of all, they put themselves at harm's way because many of those nurses became ill themselves. And also it was recorded around the world fatalities, not only among cancer nurses, but among the oncology workforce and the healthcare workforce around the world. In terms of other impacts, in terms of the COVID-19 pandemic, was the fact that non-physical event could take place during the pandemic, and still there are obstacles as we speak. So many of the training and the lifelong education of cancer nurses had to be postponed, delayed, or go fully virtual. But as you may well know, cancer nursing is a discipline and a profession that requires physical training. So there were many challenges posed in that area as well. And this is just to mention a few, but we are recovering. And I can say that the cancer nursing workforce around Europe has managed to manage the pandemic in a very good way, in a very productive and effective way. And I think that the future will teach this, will teach us from the pandemic in how to better manage and deal with future pandemics, because more pandemics will be in our way in the future.